Hi there, I'm Anna Marie De La Vega. Thank you for joining us for Focus today. Our guest is Rochelle Graham, the Chief Nursing Officer of Ascension St. Thomas Midtown. They just received a big recognition. Ascension St. Thomas Hospital Midtown has been recognized by U.S. News and World Report as one of the nation's best hospitals for maternity care. So Rochelle's going to tell us more about that. Welcome, first of all.
Thank you. Thanks for having me this morning, Anna Marie. Happy to chat more about St. Thomas Midtown, kind of our maternity care and the care we're providing every day.
Mm-hmm. Now, what is a nursing officer? First off, let's let them know who you are and what you're about.
Yeah, so I oversee all nursing operations in the hospital. It sounds like a big job. It is a big job, but really oversee all the nurses providing incredible care to our patients day in and day out.
Mm-hmm. And you help schedule them or just...
More of practice excellence to make sure that we are, meeting regulatory and practice guidelines, but also strategic growth and making sure that our nurses are always able to provide the care that's needed from our patients, whether that's new technologies in healthcare developments or new patient populations we're serving. So it's kind of a jack of all trades hat, I should say, as most nursing roles are.
Yes.
But I'm a nurse at heart and I enjoy it very much.
Would you be able to kind of clue us in on any new developments in technology or any new developments in the way that mothers and babies are being cared for?
Let's talk mother and babies. It's probably what brought us here today, right? So we just, as you mentioned, recently received the U.S. News and World Report Best Place to Receive Maternity Care. And I think as a whole, we're looking at how can we keep mom and baby, together the most. So is that rooming in rooms? Is that, providing all care for both mom and baby in the facility that we can? So regardless of the level of acuity or critical level that both mom or baby may be, how do we keep them as close as possible? Because we know that bond is so important.
Yeah.
Looking at also technologies of, there's the angel eye cameras and cameras that if my baby's in the NICU, I can check in when I'm not at the hospital, which can promote breastfeeding. It can promote bonding for the mother who isn't right there. So there's a lot of technology. It's always developing, but just kind of some of the things that we're focused on at Midtown.
Well, that's a lot. So let's try and kind of spread this out a little bit so we can take a look at some of these specific things, and then we'll move on to what else that Ascension St. Thomas Midtown is doing for mothers and babies. You first said keeping them together when possible. What does that mean?
So rooming in rooms is really what I was referring to there, but also keeping them together even in the same facility, right? So we know that after delivery, a healthy well baby delivery, both mom and baby transition to a nursery, or well baby nursery, a postpartum unit together.
Oh, together?
Yes.
I did not know that.
Yeah. And so we do couplet care. So baby stays in the room with mom the entire time, or whoever parents are, and have that opportunity for bonding. So if a baby is critical, we would take that baby to our Beeman Neonatal Intensive Care Unit, which is our NICU at Midtown. And it's 52 bays. It carries for patients of all gestationary ages. We actually have a large micro-preemie program. So
what is
we
that?
can care for babies as young as 22 weeks gestation. So when you think of how small a baby is at 22 weeks, and when you measure weight in grams instead of pounds and ounces, it's incredible. And those babies have long length of stays, can often stay up into 8-9 months, really, but have incredible outcomes. And we have really had a rapidly growing micro-preemie program, I would say, in the last 5 years, with dedication from some amazing physicians, and actually had a team who went to the University of Iowa, which is kind of the mecca for micro-preemie programs in the United States, to learn from some of the best and bring some of that care back here.
Because you know these terms, and we're like, wait, micro-preemie babies, and you said it, how many, 22 weeks?
22 weeks.
Give us a real life example of how big that baby is and what's going on at that point in that fetus's life.
Yeah, so a micro-preemie is a 22-week. It's actually a baby born earlier than 25 weeks, but we have cared for babies as young as 22 weeks. And we know when that baby is born, it can fit in the palm of a hand. It's very small.
Oh, like a few inches, a couple of inches long.
Right. So, lung development, vital organ development is crucial at that time. And so we've been able to invest in some of the technologies to be able to support these babies and help them sustain life and help them sustain incredible quality outcomes. And actually, Speaking of the micro-preemies, every year we host a NICU reunion in the fall where we have NICU families come back who have graduated, and we have babies who have, they're 10 and 12 and 14 years old now and spent months, if not longer, in our NICU. And it's incredible to see them come back and bond with the nurses, the respiratory therapists, the physicians who helped care for them. And kind of that full circle moment of the work that we do every day.
And you said graduated, meaning when they were finally released from the hospital.
So Anna Marie, when you're discharged from the hospital as an adult, it's called a discharge, right? Everybody looks forward to it. When you are discharged from a NICU, it's actually called a NICU graduation because it's such a monumental event in life and really marks an achievement of so much. So we call it a NICU graduation.
If a baby is at under 25 weeks, have their lungs developed? What has not developed that you're able to, at Ascension St. Thomas Midtown, that you're able to keep them alive while that develops? And how do you do that? Give us just some general stuff.
So I should have brought my NICU nurse friends to talk about this morning. Full transparency, my background is not is oncology. It's not neonatal nursing, but I will say that lungs are one of the last organs to develop. Okay, so when you think of in a 40-week gestation, lungs really don't develop until after 34 weeks.
Oh, wow.
So 22 weeks, we're still focusing on other vital organ development.
Yeah.
We have to support lung development through ventilation and, to make sure that we're oxygenating all organs to support their development as well. But there is a lot of development that hasn't happened yet.
Yeah.
At 22 weeks.
And so it's kind of like, since they still should be inside the mother in a perfect world, they're outside, but you have to protect them, nourish them, and nurture them as if they are still inside.
Correct.
That is miraculous. That is miraculous.
Yes, it is. Tiny babies they require the most equipment, right? You would think smaller, less, but really tiny babies require the most equipment, from jet ventilators to warming systems to keep them the temperature like they're in the womb. And they're very sensitive. And so they're sensitive, but at the same time, babies are super resilient. And we just have become smarter over the years to be able to care for these babies at younger gestational ages. It really is incredible.
That's amazing. I had no idea that it had gone this far. This is fantastic. And so we're talking today with Rochelle Graham, the Chief Nursing Officer at Ascension St. Thomas Midtown, recently recognized by U.S. News and World Report as one of the nation's best hospitals for maternity care. And this is meaning for the moms and the babies. And first of all, you said the room, is it like they have like a little enclosed space in the room? It's just they have a bed in the room with mom, or vice versa?
Yeah. So for our Well Baby Nursery, we provide couplet care, which is all moms and babies are in the room together. Now, there is an option to send a baby to the nursery, which is kind of what we would say standard care was 20 years ago, not even that long. We still do have a nursery on site, but we have couplet care, which is where babies are able to room in with their parents and really promote that bonding for all of our Well Baby Nursery. In addition, when we think of maternity care, we think of the decisions that you can choose, right? There's natural versus medicated, there's C-section versus vaginal, and there's a lot of different options. And I would say there's trends that have came up over the last 5-10 years. And
trends in baby birth?
There's trends in everything, right, Anna Marie?
Like what?
And it's cyclical, I think. So, home births are very popular right now. And how do I have the experience of a home birth, but at a hospital? And so we have a birthing center, which when you're in looks like, as close to your living room as possible, with full-size bed and true furniture that you would find at your living room at home.
Oh, my
but
gosh.
Also provides the support of being in a hospital. And so we offer our birthing center suites. We have, many different labor and delivery options for the moms. We also offer a birth designer, and probably one of the things I'm most proud of, first of all, I always say a birth designer sounds like a dream job. And ours is fabulous. And maybe that's why. So our birth designer helps moms make a plan that is safe for them, both medically, but also meets their needs. So if they're wanting a certain type of delivery, but for whatever medical reason they can't have that, or if maybe they're new to town and they're not sure what they want and they want to see options. So our birth designer is really there to kind of bridge the wishes of moms and the reality for a safe delivery, and works really closely with our patients for that.
So like if you were dreaming of the home birth, that's where the designer would come in and say, well, we have this. So you schedule it? Do you just
Yes, you can schedule it, and you can go online to our website and schedule time with our birth designer. We also have many birthing classes that we offer.
Oh, that's good.
For the community. I've been a partaker in those myself in recent months, right? So we offer birthing classes for wherever, regardless of where you're delivering at, and ranging from breastfeeding classes to natural baby classes to first-time parent. I mean, there's hundreds. I couldn't name them all.
What is a natural baby class?
A natural baby class is focusing on a natural birthing opportunity. So unmedicated could be if you're having a home birth, maybe incorporate some type of Lamaze or breathing techniques into it. So there's options for everyone.
This is Rochelle Graham, the Chief Nursing Officer at Ascension St. Thomas Midtown. Now, so you said you've taken the birthing classes?
I have, yes.
Because you're pregnant?
I'm expecting my first child here in the next couple of weeks.
Oh, my. Was there anything that, I know being a nurse, you probably knew most of these things already, but was there anything that you think when other expectant moms maybe take the classes that they're like, whoa, did not know that?
I think there's probably a lot of things. What I always say is, and I think many nurses are this way, when you're the patient, you want to be treated like you're not a nurse, like, because you forget everything. You forget everything. You're like, talk to me like I don't know what I'm doing. But also for, my husband, who is not in healthcare whatsoever, I think having him learning from someone else is better than him learning from me. And
very good.
You know how that works. But I always recommend our birthing class. I think they're good reassurance. They're good. It's just good tools to have in your tool belt for an unexpected time. And so I'm really proud that we offer those for the community.
My parents' generation or grandparents' generations did not have that. So some of them had kind of no idea what to expect, what was going to happen, what's next.
They're just hoping for the best.
I know. Oh, I hope I don't have it in the cab on the way to the hospital. So what else do we offer at Ascension St. Thomas Midtown that makes them so widely recognized as one of the top places to have a baby? Well,
you mentioned have it in the cab on the way to the hospital.
Oh, no.
So we have a dedicated OBED and a dedicated GYNED, two separate spaces.
What are those?
So our OBED is for moms 20 weeks and greater in gestation who are experiencing some type of obstetric emergency. We know that main EDs may not always promote the best healing, just considering the environment. And so this is really a dedicated area for moms 20 weeks and greater in gestation.
And ED means?
Emergency department. Yeah.
Okay.
Thanks for checking me on that, Anna Marie. We also have a GYNED. And so that's for 20 weeks and less gestation, but it's also for other gynecological emergencies. Mm-hmm. And that dedicated space for women who are really experiencing something and having promoting healing and just comfort in that space. So if you have it in the cab on the way to the hospital, our OBED will be ready to receive it when you get there, is where I was going with that.
Yeah.
Because we know that sometimes babies are, they're the boss and they're going to come when they want to come. And sometimes that is in the car.
Oh, no, you're scaring me now. This interview to be a couple months later, maybe. Okay, so and then what else?
Yeah, so kind of just growing on that, we're a level 4 maternity center, and I know you're going to say, what's that? And what it means is there is not an emergency that a mom would experience during obstetrics that we could not care for. And so we are the highest level, we are able to provide the highest level of maternity care, and we have a great partnership with MFM, a maternal fetal medicine team, and a support from our obstetricians in the community that allow us to do that.
Yeah. What kind of things would require somebody from maternal fetal medicine to get involved?
Yeah, if baby is deemed high risk for countless reasons, if mom has maybe history of cardiac background or maybe other preeclampsia background.
Which is high blood pressure.
High blood pressure, yes, thank you. With other deliveries, that could kind of trigger. There's multiple things that can trigger, but that really supports our outlying facilities. And what I mean by that is, here in Nashville, we are blessed to have access to great health care. But that's not always the case when you just go even an hour outside of Nashville. And so it's allowing us to care for those high-risk moms. If they need to be transferred into Midtown, we can. We have partnerships that we support transfers into the city to care for those moms. And they may spend some time on our OB high risk or our antepartum unit, where moms can spend up to weeks at a time if they're bed rest and needing consistent monitoring pre-delivery. And so we're able to provide that care kind of right all in the same location.
Rochelle, one of the reasons that I knew something about preeclampsia or something like that, as I've been watching a show called Call the Midwife, and I see you have certified...
We have midwives. Yeah.
Midwives. So what is that exactly?
I've never heard of Call the Midwife. I need to know more about this show.
Pretty cool.
Yeah. So we have midwives who support deliveries for moms as well. And so we have them both with our private partnerships and OB clinics in the city, but also have midwives who are always in our OBED and
emergency department.
That's right. Support mothers through delivery and are the provider for their delivery.
Really? So you don't go in and here's some random person that you don't know. This is your midwife that you've been working with.
Correct. Now, if you come in through the emergency department, you probably don't know that midwife. But yes, you can have midwives through our clinics, and they are who are the providers in our OBED, our emergency room.
What about other things like that sound a little bit non-traditional that Ascension St. Thomas Midtown is offering for moms and families?
Yeah. So one of the things also that I'm really proud of is our volunteer doula program. And we have a volunteer doula program which supports moms who come in maybe wanting a doula or don't have a birth partner or maybe need a better support system. They can opt for our doulas who actually volunteer to be support members for our moms if they wish. And so that's something that I think is probably non-traditional. In my experience, I haven't found that in many facilities. And I think it just speaks to our mission of caring for all patients, regardless of the walks of life, and being able to provide that support for them.
What is a doula?
The best way to describe a doula, I would say, is a birth support partner or a birth coach. They have they have education in supporting healthy births, are really able to help mom through coping of births, breathing techniques, decision making if she were to need it. So they're kind of just a really good partner to have.
So like if you don't have a mom or a partner or something, a doula gives you not only that support, but informed support.
Correct. Yes. And not just if you don't have them, many patients with their partner opt to seek a doula and bring them in during their birth journey. And we're incredibly supportive of that and always proud when we can partner with doulas to offer it for even more patients.
I love that. And now has Ascension St. Thomas Midtown been doing that for a long time?
Oh, that's a good question. I've been in my role for 2 years, and we've been offering it since I've been there. Yeah. I would say probably a while longer than that.
Yeah,
though.
Pretty ahead of the curve, I think. If you're just joining us, I'm Anna Marie, and this is Focus. We're talking to Rochelle Graham, the Chief Nursing Officer at Ascension St. Thomas Midtown, and it's number one because they've just been recognized by U.S. News and World Report, very good, reliable source. This is not the fake news stuff you see online, but they've been recognized by U.S. News and World Report as one of the nation's best hospitals for maternity care. And that means moms, babies, families.
That's right. Families is the best way to say it, Anne Marie. And I think, many of Nashville is transplants, right? Myself included, have been here for 10 years. But that's a big decision when you move to a new hospital or a new city. And if you're starting a family, where do you have a baby? And I think it's a research project, for lack of better words.
Yeah.
So you look to your community, you look to your friends, you look to your family. I'm proud of the reputation that we have in the city. 1 in 3 babies are born in an Ascension facility. 1 in 5 in Middle Tennessee are born at Midtown.
Wow.
So statistically, when you're, sitting at a table at dinner, somebody around the table was born at Midtown. And I always love when I'm out in the community and people ask where I work, or the baby hospital, or, oh, I was born there. Or I hear, nurses come back to work for us because they were born here or their parents were born here. So we have just south of 7,000 deliveries a year at our Midtown facility. And I think we do really great work and provide really great care for families and for new moms and babies, and continue to work to carry that reputation on. So
is there a way that the community can support Ascension St. Thomas Midtown in continuing that mission?
Yeah, great question. So we have a great Ascension St. Thomas Foundation, which is always available. But one of the things that we do, an event we host every year, is Rock the Cradle. And I say every year, it actually just came back from a 5-year hiatus. This past year, we had Tim McGraw at the Pinnacle, and that's our fundraiser for our Beeman Neonatal Intensive Care Unit. And It's also a fundraiser for our Women's Service Line. So helping our labor and delivery and our postpartum units, in addition to the Beeman NICU. That event will be happening again this fall. And so it was on a 5-year, what we will call COVID hiatus. I think kind of took a step back, but it's back and better than ever and continues to grow. I think that's a fun way when you can mix babies and music in the Music City, right?
Yeah.
And kind of have a fun night, but for a good cause. It always is a good time.
What you said, a women's service line?
Yeah. So when we think of maternity care, that's part of our women's service line. And so that's really the service line as a whole at the hospital, where we're providing care from cradle to grave for women. And how do we do that?
Yeah. Yeah. Are there new developments that you can share with us for moms who have had maybe high-risk pregnancies or have seen that in family members that maybe they would want to come specifically to Ascension St. Thomas Midtown to explore and ask about?
Yeah. So in terms of high-risk moms, I'd love to talk a little bit about our Women's Heart program. Okay. And you probably feel like, oh my gosh, Rochelle, we've talked about everything women's here today. So we haven't talked about Women's Heart, which is really Dr. Nish Shireen has grown this program to support high-risk mothers and women, not just mothers, but women with cardiac backgrounds or with cardiac needs, because we know that differs so much from the male population. And that's something that we offer for, moms often need that if they're high risk and whatever their diagnosis may deem that, but also for women in all stages of life. And so, Dr. Serene and the Women's Heart program is growing, but continues to support Middle Tennessee women in their needs.
We've spoken with her on our public affairs program. She is amazing.
She is an angel.
And there are so many things that are different about women in heart disease and women in heart health than men in heart health. And so far, the studies had been men. Mm-hmm. For most of our lives, they had been. And now they're still discovering lots of differences in women and men and the needs of their heart health.
Right. Even just presenting symptoms, right? From having, heartburn in a woman and can be completely different, an indicator of a cardiac event, whereas in men, not so much. So just small things that we have thought of so much to be the same between men and women in cardiac care has definitely changed. And like you said, just still discovering that.
Yes. One of the things that will stick with me forever is a lady who talked to me one time. She said she had a heart attack and she had jaw pain. Mm. And she kept telling her son, I heard that jaw pain can be a symptom of a heart attack. And he was like, Mom, no, blah, blah, blah. And she finally said, please take me to the hospital. And she was having a heart attack.
My goodness.
I know. So women do need to be educated about that. In fact, you got me inspired. I'll post some more links on our Focus Facebook page. What else do people need to know? What are the 3 key things that you want to make sure that we remember about Ascension St. Thomas Midtown?
Right. Yeah. So I think 3 key things, just our comprehensive service line for the women's care that we provide, from the smallest of babies, 22 weeks, to the Women's Heart program, caring for, women of all stages of life. I also think you think of our partnerships in the city and the services with our birth designer, and being able to really pair a wish with a reality of a healthy delivery, from our birth center to our standard labor and delivery rooms, whether it's a vaginal delivery or a C-section delivery. Just a safe delivery is what we want. And we want a safe delivery that meets mom's wishes. Mm-hmm. And then lastly, I think I want everyone to know our mission and our compassion for providing great care. And we didn't earn this reputation overnight, but it's years and years of compassionate care given to moms and families and babies. And we're really proud of that. And we worked really hard for that and want to keep making a difference in our communities.
As a pregnant lady, what difference does it make when you think I work at, as you said, the baby hospital at Ascension St. Thomas Midtown? How does that make you feel when people are like, oh, you're pregnant, congratulations?
It's, I can say that I've never been a patient. I'm so grateful for that. And so in my life, having this be my first patient experience as I'm getting ready to deliver in a couple of weeks is exciting. I'm excited to do it at our hospital where I know we provide great care and experience this care that I tell everybody about, right? And it feels like I'm a little bit of a poser if I'm telling everybody it's great. And now I can go through it and tell everybody it's great from my experience. But I think it's such a big decision. And when you think of all of the moments in healthcare, birth's probably one of the few where people walk in excited, right? A hospital and a hospital stay is one of the most stressful and hard things on a family. And so this is one area that's exciting and can really, in most cases, can really make a big difference in our families' lives. And so we're honored and privileged to be able to do that and want to make sure it's a memorable experience for them.
Do you try and make sure that the family is included?
Always. Family-centered care is kind of pivotal. In our labor and delivery unit, we operate on a team birth model, which is really just parents, baby, who is still in the womb, right? Providers, all part of the birth plan, and making sure everybody is aware, everybody has a voice. And that's so important because this is a family journey and we're excited to be part of it and honored and privileged to be part of it.
Thank you so much for joining us.
Of course. Thanks for having me, Anna Marie.
Rochelle Graham, she's fantastic. She's the Chief Nursing Officer at Ascension St. Thomas Midtown, recognized by U.S. News and World Report as one of the nation's best hospitals for maternity care. But a lot of us here knew that already. Thank you.
Thank you.
We'll post some links and more information on our Focus Facebook page. Please make sure you join us again next week. I'm Anna Marie, and that's Focus.